Today we are going to demonstrate 3 common exam tests for the diagnosis of thoracic outlet syndrome. First, we'll use the most common exam finding, which is the Roux test. In the Roux test, the patient is asked to bring their arms into 90 degrees of abduction and 90 degrees of external rotation, and then they repetitively open and close their hands, making a fist. At any time over the course of 3 minutes, if they experience reproduction of their symptoms in the affected extremity or experience fatigue before the 3 minutes, this would be considered a positive exam test for thoracic outlet syndrome. Okay. Next, we will do Wright's test, which Wright's test is looking more towards a vascular component of thoracic outlet syndrome. We start by palpating the radial artery. And once we have a good palpation of the artery, we bring the patient's arm into 90 degrees of abduction and 90 degrees of external rotation. The patient rotates the neck away from the affected extremity, and if the radial pulse is reduced and or there is reproduction of symptoms, the test maneuver is considered positive. And oftentimes we will have to compare this to the other extremity to see what the response of the radial artery is. Okay. And lastly, we'll show you the Adson test. The Adson test is somewhat similar to the Wright test, where we are palpating the radial artery. We this time, however, bring the arm into full extension, okay, and then slight abduction. At this point, the patient is asked to rotate the neck and extend the neck at the same time. And at this point, the radial artery is reduced or there is reproduction of the symptoms, the test is considered positive.